Welcome to This Explainer. I am absolutely thrilled you're tuning in today because we're about to embark on a truly wild biological journey. We are going to look right at the top of our heads and literally peel back the layers to uncover the brilliant, intricate, and honestly sometimes downright surprising anatomy sitting right there on top of our skulls. Let's get right into it. So, to kick things off, I want you to think about a medical mystery we can all relate to. You ever noticed how when you get even a tiny, minor cut on your head, it bleeds so much it looks like a scene straight out of a horror movie? Seriously, there's just so much blood. We've all either experienced this firsthand or seen it happen. Well, today, we're going to solve that exact mystery by reverse engineering our own anatomy. But before we crack that case, we really need to define what the scalp actually is. A lot of us just think of it as the spot where our hair grows, right? But it covers way more real estate than that. It's the entire layer of soft tissue covering the cranial vault, basically the whole roof of your skull. Interiorly, it starts right at the supraorbital margins, which are your eyebrows. Posteriorly, it goes all the way back to those superior nuchal lines at the base of your head. And laterally, it drops down to the superior temporal lines on the sides, which means your forehead is literally shared territory between your face and your scalp. Okay, so let's dive into the actual structure. The scalp is made up of exactly 5 distinct layers of tissue. And in a stroke of absolute brilliant anatomical luck, the first letters of these 5 layers perfectly spell out the word, you guessed it, S-C-A-L-P. Skin, connective tissue, aponeurosis, loose areolar tissue, and pericranium. It's literally a medical student's dream mnemonic, and it's going to serve as our roadmap for today's explainer. So let's start right at the surface with the S, the skin. This outermost layer is exceptionally thick. It's packed with blood vessels, and of course, it's mostly hair-bearing to protect our skulls from trauma and, keep us warm. But what's truly fascinating here is the sheer density of glands. This layer is incredibly rich in both sweat glands and sebaceous glands. And because of this massive concentration of sebaceous glands, the scalp is a notoriously common site for developing sebaceous cysts. Moving down, we hit the C, the connective tissue, or the superficial fascia. This layer is dense, it's strong, and it's highly fibrous. And guess what? Right here is where we solve our opening mystery. This dense fascia firmly glues the skin above it to the structures below, locking everything into place. But more importantly, it physically holds the blood vessels wide open. When you get a cut on your scalp, those blood vessels are literally trapped in this dense, fibrous web. They can't retract or shrink away to seal themselves off like vessels in other parts of your body do. The clinical result? The wound just bleeds and bleeds continuously. So knowing that, here is a massive, practical first aid takeaway derived directly from this anatomy. Because those vessels simply cannot retract on their own, the only way to stop that profuse bleeding is by manually doing the work for them. You have to apply firm, direct pressure right against the hard skull bone underneath to physically squish and compress those stuck open vessels. All right, next up is the A in our mnemonic, the epicranial aponeurosis, sometimes called the Galea aponeurotica. This is the deep fascia of the scalp. I want you to think of this layer as a highly tensioned biological bridge. It acts as a super tough, fibrous sheet connecting 2 major muscles, the frontalis muscle at the front of your head, which is what raises your eyebrows in surprise, and the occipitalis muscle way at the back, which pulls the scalp backward. And this sets up a brilliant clinical rule of thumb. Because this aponeurosis is under constant opposing tension from those 2 muscles playing tug of war, the direction of a scalp cut matters immensely. If you sustained a transverse wound, meaning a cut running left to right across your forehead, it's going to gape widely open because the frontalis and occipitalis muscles are actively pulling the edges apart in opposite directions. But if you have a longitudinal wound running front to back, it barely gapes at all. The muscles are just pulling parallel to the cut. Moving on to layer 4, the loose areolar tissue. Also known by its very dramatic clinical subtitle, the dangerous area of the scalp. So this spongy, loose layer is actually what allows the top 3 layers we just talked about to slide and move freely over your skull. But it earns its dangerous reputation because of its plumbing. It contains these things called emissary veins. Emissary veins are special vessels that act like direct anatomical highways. They literally connect the superficial veins on the outside of your scalp, go straight through the skull bone, and dumped directly into the intracranial venous sinuses. Those are the major blood channels right inside your brain cavity. Normally, their job is just to help equalize pressure. But because they act as a direct, open highway, they're the absolute perfect route for a stealth attack. If you get an infection in your scalp, that infection can travel straight down these emissary veins right into the cranial cavity.
It can spread to the superior sagittal sinus or the sigmoid sinus and lead to absolutely terrifying, life-threatening complications. We're talking meningitis, cavernous sinus thrombosis, and even brain abscesses. And that, my friends, is why it is the dangerous area. But wait, it gets crazier, because infections aren't the only things traveling through this loose layer. The tissue is so spongy that if you take a hard hit to the top of the head, blood can collect and spread completely freely throughout this layer. But then, gravity takes over. The blood literally tracks smoothly down through the loose areolar tissue, sliding right off the forehead and pooling down into the root of the nose and the eyelids. This mechanical fluid dynamic is exactly why a blow to the top of the head frequently results in a classic black eye. Finally, we reach the P in our SCLP mnemonic, the pericranium. This is the periosteum, basically the dense membrane directly covering the outer surface of your skull bones. It plays a super vital role in nourishing the bone and helping it repair. Now, pay close attention to how it's attached. It's actually really loosely attached over the broad, flat parts of the skull, but it dips down and is incredibly firmly attached at the sutures. Those are the zigzag seams where your different skull bones physically fuse together. And those super firm suture attachments create our next fascinating clinical rule. If bleeding happens deep down, specifically underneath this fifth layer, it causes something called a cephalhematoma. Because the pericranium is virtually glued down at the seams of the skull bones, the blood is physically fenced in. It's completely trapped. A cephalhematoma is strictly limited by the sutures, and it cannot cross those lines. So if bleeding happens over the parietal bone, the swelling will form a perfect exact outline of just the parietal bone. All right, let's look at the plumbing and wiring, the vital supply lines keeping the scalp alive. When it comes to the arterial plumbing of the scalp, the magic number is 5. There are exactly 5 paired arteries constantly pumping a rich, heavy flow of oxygenated blood right into those dense tissues. If we map out those supply lines, 3 arteries supply the area in front of your auricle, which is your ear. Those are the supratrochlear, the supraorbital, and the superficial temporal arteries. Behind the ear, we have 2 more, the posterior auricular and the occipital arteries. But the absolute most important thing to note here is their origin source. The scalp gets its blood supply from both the internal carotid artery system and the external carotid artery system. And these 2 massive networks freely anastomose, meaning they literally connect and cross-feed each other all over the scalp. Now, we talked earlier about how this insanely rich blood supply causes profuse bleeding. But here is the massive, incredible clinical upside. Because of this beautifully cross-fed arterial map, scalp wounds heal incredibly rapidly. There is a very low risk of tissue necrosis or tissue death, because if one single artery gets damaged, the others just pick up the slack. In fact, this plumbing is so robust that even if a scalp is completely avulsed, like torn completely off the skull, it has a remarkably high chance of surviving and healing up beautifully if surgeons reattach it. It's honestly amazing. Okay, moving from the plumbing to the wiring, the nerves. While there are 5 arteries, there are exactly 10 individual nerves firing on each side of your scalp just to keep it communicating with your brain. And when we break down that wiring, it reveals a super fascinating biological bias. Out of those 10 nerves per side, a whopping 8 of them are purely sensory nerves. That means their only job in the world is to let you feel things, temperature, pain, or just the wind blowing through your hair. Great examples are the supratrochlear and the greater occipital nerves. Meanwhile, only 2 out of the 10 are motor nerves, the temporal branch which supplies that frontalis muscle, and the posterior auricular branch supplying the occipitalis. So basically, your scalp is heavily hardwired just for sensation over motion. So there you have it. We've unpacked the structural layers from the skin all the way down to the bone, we've mapped out the complex plumbing, and we've traced the sensory wiring. I want to leave you with this final thought. The next time you see a boxer with a black eye, or maybe someone with a profusely bleeding but totally minor head bump, are you going to look at it just as a simple everyday injury? Or will you now see it as a brilliant reverse-engineered roadmap of the scalp's 5 incredible layers springing into action? Keep exploring and never, ever stop wondering how we're put together. See you next time.